Well, I'm very pleased to be joined with here today on Primetime Local News with Dr. Nelson Chan. He joins me from Ontario. Dr. Chan, first off, thank you for joining us. And I know the city that you're in is not a major hotspot, but I would like for you to give our viewers just a scope of how chaotic the COVID situation really is in Ontario.
Oh, I think we're well into the third wave at this point, and we're not quite seeing an end in sight. We're supporting. We're obviously supporting the province and the city, but we are accepting patients being transferred from the hotspots like in Toronto and coming to our major hospitals. So yeah, it is definitely getting worse.
In your opinion, what could have been done better in the province to prevent the numbers from being what they are now?
I don't think to be honest, I don't think there's an easy answer. I think, there's different pros and cons that we need to weigh, from a strictly, just to strictly stop the virus. I do think that we would probably have needed more, needed stricter physical distancing rules and perhaps more stringent rules during the lockdown. So I think that would have helped, but we obviously need to balance that with those who are affected and both, especially the mental health aspects of feeling, isolated and feeling lonely as a result of these lockdown rules.
Do you think Ontario will dig themselves out of this hole that they're in right now?
I do believe that. I think there is some signs. I think I feel like the province, I think as a whole, healthcare professionals are overstretched, but we continue to work hard and we are starting to coordinate with other hospitals. And like I said, examples of transferring patients from hotspots to places like here in London will help offload those patients that can then make room for COVID patients.
Now, you yourself are, of course, a family physician, and you've administered many COVID vaccines in Ontario. What are some things that your patients are saying to you or that are hesitant about when it comes to getting their COVID vaccine?
I think it's a great question. The way we're rolling out vaccines, I'm not as familiar with how other provinces are doing. Is that I think I think the initial efforts have been to create mass vaccination clinics, and I've participated. I've worked in some of these mass vaccination clinics. So they've kind of left, and then they rolled out to the pharmacies. I do think that primary care, so family medicine clinics, have an important role to play, and I think they're trying to get us on board now is sort of like the second or the third wave, I guess. And I guess going back to your earlier questions, I think if primary care was involved a little bit earlier in terms of the vaccine rollout, I think you would maybe see higher uptake. I think a lot of vaccine hesitancy can be alleviated when you're being vaccinated by people who already know you, who already know your medical history, and I think that's the piece that's been missing. And there's been some studies that have shown that that patients are more likely to trust their family physicians when it comes to questions like vaccines.
Can you put it into perspective for us, for people that choose not to get the vaccine, and just how things could possibly escalate further of the spread of COVID, not just in Ontario, but also across Canada?
I actually think that the main problem right now has more to do with vaccine availability. I think that seems to be the point. That seems to be kind of like the bottleneck, so to speak. I don't see as much vaccine hesitancy. Certainly, I have just had a lot of discussions with my patients. And as they have questions about vaccines, their questions, a lot of their questions has to do with not so much whether to vaccinate, but really about which vaccine. And as you know, there's been a lot of discussion around the safety of certain types of certain vaccines that are out there, and I think they are particularly concerned about that. I think as soon as the supply becomes available, I think then we'll have a better idea of vaccine hesitancy, because right now those who are hesitant are probably around that age where they tend to be a bit younger, and so they're not quite qualified for, say, the Pfizer or the Moderna, but they're qualified for the AstraZeneca. So there is some questions around the safety in their minds.
And lastly, Dr. Chan, what's some advice that you would give to people to help protect themselves right now?
So my advice would be, once you qualify, get in line and get vaccinated as soon as possible, and observe the guidelines that are set forth by your province.
Well, Dr. Chan, I really appreciate your time. Thank you very much for joining us and giving us an insight on the situation in Ontario right now. So thank you.